Ens hem de posar en clau de ponència inaugural i això vol dir també parlar de legislació. Els canvis legislatius introduïts a la Unió Europea, tant en les institucions comunitàries com en els estats membres, són conseqüència directa, si us hi fixeu, del lideratge de la lluita de tantes i tantes associacions al llarg dels anys, que s'han anat aconseguint a poc, pas a pas, però que sí, es pot aconseguir conscienciar polítics, institucions, professionals, el sector farmacèutic, altres agents implicats a implementar aquestes polítiques realment efectives per lluitar contra totes les malalties minoritàries. Aquí ho demanava també aquest clam d'UNZUE. Uns canvis que s'han portat a terme i han ajudat en col·lectius organitzats, ja sigui a nivell regional com nacional. Abans el senyor també Coyuel en parlava, FECAM, FEDER, EURORDIS, que és la ponència inaugural que tot seguit els presento. Per tant, des d'Europa es fa aliança, es fa pinya, hi ha credencials que ho demostren, es treballa de valent per aquesta millora contínua de la regulació, el foment a la igualtat d'accessos d'aquests afectats de malalties minoritàries en tots els àmbits. Penseu que EURORDIS, d'aquesta organització que plega 956 organitzacions de pacients de 73 països, treballen, com dèiem, junts per millorar la qualitat de vida de milers de persones en malalties minoritàries a Europa. Avui, doncs, el senyor Yann Le Camm és l'encarregat de donar el tret de sortida, ja més des de l'expertesa en connexió per streaming, amb una traducció simultània que podeu seguir si disposeu de l'aparell. Si tenim aquesta ponència preparada, doncs anem a parlar d'aquestes accions a nivell comunitari, europeu, i doncs donem pas al CEO d'EURORDIS, de Yann Le Camm. Thanks for being.
Muchas gracias.
Gracias.
Muchas gracias. Me ha agradecido mucho de estar con usted para el streaming. Buenos días a todos y disculpe, pero me voy a hablar en inglés. Congratulations first to all of you for the Rare Disease Day actions that you're implementing this week and for this beautiful conference that you're putting together today. I'd like to really thank the efforts, the beautiful work of Cat Salute and also of FEDER, of FECAM, and all the patient groups involved and partners of the program today. But also I would like to mention our friends in academia at Vall d'Hebron, at San José de Déu, and at the University Autonomous of Barcelona or the Sant Pau Knowledge Center, as well as CBRR for Spain more broadly. In this inauguration, I have been invited to speak about mostly two things: the current policy, let's say, at the European level with the foresight study that we just concluded, and after that, to speak about COVID. So let's start with the foresight. The European Parliament has initiated some years ago a foresight study on rare diseases to look long-term, to look 2030, 2040, and at the European level to see what's coming up. And obviously, we suggested that to European Parliament, and European Commission has then funded a call for proposals. Unfortunately, we've been selected with different partners to conduct this study over 2 years, which just concluded this week. We had on Tuesday a conference with the final recommendation. So for the one who are more interested into what I will say now, you can always go back to the website of what is called Foresight Study Rare 2030. The methodology is nice because we started with a knowledge base of what do we know today about the diagnosis, about the care, about the organization of healthcare, about the social impact, etc., on rare diseases. And there was a panel of 250 experts from all over Europe, multi-stakeholder experts, clinicians, researchers, patient advocates, policymakers, media, companies, all sorts. And they identified 12 major trends for the future, for the next 10, 20 years. And also some wildcards. Wildcards are things like COVID, which then suddenly changes all the scenarios. And based on that, they came up with 4 scenarios for the future. And the preferred scenario out of this is called investment for social justice toward 2030. And the 2 triggers of this scenario are innovation, which is patient needs-led innovation. So not innovation driven only by technology or by the market, which both are necessary, obviously, but innovation which fits the purpose, which is meaningful to address the needs of patients. And the second axis is solidarity. So how we have a collective responsibility to care with social justice for the people who are accumulating more vulnerabilities than others in the population. And with this policy scenario, we came up then with policy recommendations for 2030. And the essence, I would say, of this scenario, what is really changing to what we were doing 10 years ago, are the following. Is that the recommendation for 2030 is to say now, with all the knowledge we have, all the experience we have, all the good practice we have, and some of the milestones in place, like centers of expertise, some registries, some good research, etc., we can take a new step. Now the step can be a public health objective, to have objectives which are qualitative for people. So to have a strategy which is based on performance and on innovation. On performance, it means to be able to measure and to improve by 2030 the time to diagnosis, the percentage of the people living with rare disease which will be then actually diagnosed, and the reliability of this diagnostic, not to have misdiagnosed. And here we're proposing to have the ambitious goal to say that 90% of the people affected by one rare disease should be diagnosed within 6 months after the first contact with a medical doctor or a healthcare professional. That means using newborn screening, using whole genome sequencing, and other methodologies and processes. The second is to have an ambition on survival and quality of life. We see that the management of care is improving. We see the value of integrated care between medical and social to improve the health and the social measurable outcomes. And this is what we can have the ambition for, is to improve survival with new transformative technology, with curative technologies even coming in now. And that's a possible horizon. For instance, the Imperial College of London, one of our partners in the project, has done a retrospective study and a prospective study, and it is estimated that 600 new therapies should be approved for rare diseases in the next 10 years based on what is in the pipeline and compared to the success ratio of the previous years. So that means that if we improve that with adequate policy, maybe we can get to 1,000 new treatments. Now the issue is, how do we pay for that? And that's why solidarity comes in. And that's why European collaborations comes in, because it is only through European collaboration that we can organize Europe as one market, and that all the purchasers, all the payers, we can come together with a big weight in order to negotiate the volume and price, but also to generate the additional evidences needed in Europe on these new medicines. By 2030, also the impact of the disease on the social and economic aspect for the families can be improved. The ambition here could be to reduce by 30% the social and economic impact on the patients and the families. This is very much aligned with the Sustainable Development Goals. So now, to put it into another perspective, what is changing in this strategy is that it's a holistic approach which is going from the persons. It's based on the person needs. And it's also a holistic approach which brings together an integrated strategy between member states and the European level to bring together research and care. The line between research and care is blurring. In our major hospitals, like the one in Barcelona and Valdebrón, Sant Andreu, there was hospital or University of Barcelona, all that, it's, you know it, for rare disease. It comes together. So it's research and care together, and it's powered in the middle by the new digital technology and the data analytics. What does that mean? It means that we need to have interoperability, standards and harmonization, capabilities in terms of human resource and technology to do it well. And this is all the point of the conclusion of this foresight study, is that it calls for it provides a roadmap for the next 10 years, but it also calls specifically for a new policy framework at the European level, a new council recommendation on rare diseases, which has that kind of qualitative ambition to improve the health and social outcomes of patients by 2030 and to reduce the economic and social burden. This roadmap will have an immediate effect on some of the new policy of the European Union. As you know, the European Union works with multi-annual financial framework. So we're starting a new one from 2021 to 2027. As you know, that has been voted by the member states. And within that, there is the EU for Health program, which is the health program, obviously. There is the Horizon Europe program, which is the research program. There is the digital program. So in these areas, the roadmap provided in this study and other works already performed by other partners are informing these policies to have rare disease high on the agenda in these policies. The structural funds are very important, and we need Spain, as any other member states, to really push to have rare diseases mentioned in the priorities of the use of European structural funds in order to be able to support major initiatives of our university hospital centers with adequate genetic clinics, but also a coordination of the healthcare pathway, but also collection of data on big scales. There is a revision, there is important policy, new policy, let's say in Europe now, which is the EU Pharma Strategy, which particularly address 4 pillars and 2 highly relevant to rare disease. One is to better address the unmet medical needs. So here we're talking about all the rare diseases for which there is no treatment or no satisfactory treatments. So the vast majority, in fact. And also the second pillar is on improving access. It's a time of change. We can have higher ambition to improve access, to reduce these inequalities, which are not acceptable since 15 years. There is also the revision of the orphan drug regulation, which is starting now, and of the pediatric regulation and the incentives. And here, we, as a community, we need to be attentive that all that is not just about shrinking the incentives and reducing the scope and disconnecting from the global research, particularly from the US legislation, but to be focused on addressing the unmet needs and improving access to care. That's what we want to get from these revisions. There is also an evaluation of the cross-border healthcare directive, which is highly effective when it comes to the European reference networks of rare diseases, and Spain plays a key role into that. And in Barcelona, there are several major centers, part of it. But what doesn't work is the coverage of expenses across borders for rare diseases, the coverage of asking for a second doctor opinion or getting a surgery somewhere else, and even worse, when it is about getting a treatment in another country. Next year, there will be also the launch of the new cycle of European Reference Network, which will be for the next 5 years. And here it's important, and the recommendations we have developed will also play an important role on that. So we have a unique opportunity really in front of us, and we should be proud of what we've built in Europe. What Spain and Europe has done has been inspiring other countries in Central and Latin America. Mexico, Argentina, Colombia have all developed now national strategies on rare diseases, but it's the same in South Asia with New Zealand, with Australia, and now in fact the 21 country of the Asia Pacific economic cooperation are working on national plans based on 19 pillars. So very much inspired, as we did in Europe, with the national strategies and plan. So it's not the moment to give up on that strategy in Europe. We need to have a new cycle for the next 10 years of strategy to integrate all that much more. I would like to mention, before going to COVID for 5 minutes, I would like to mention the fact that we're also progressing at the international level. These European efforts are into an international level of the Sustainable Development Goals, where rare diseases are recognized as being part of these goals for 2030, and that the call of leaving no one behind in this global development strategy fits really the cases of the people living with rare diseases around the world. And within that goal, 2 years ago, rare diseases was mentioned in the Universal Health Coverage Political Declaration of the United Nations. And I want to mention that Spain was one of the countries who helped us to obtain it, and want to thank Spain for that. And now we're working toward the development of a United Nations resolution at the General Assembly to address the needs of persons with rare diseases. And we hope to be able to do that maybe this year in September 21. Spain is supportive. Spain will confirm soon their role to be probably one of the leaders. And I would like to thank your community for that. I would like to thank individually FEDER for their strong support and in bringing along a lot of the partners in Latin America, but also to thank Manuel Posada for his contribution along the years and coming years on this aspect, and Josep Torrent Farnell, who is a relentless advocate of global cooperation and Ibero-American cooperation. So to conclude on the orphan drug, sorry, on the COVID, is I want to be too detailed. You know, all the impact in terms of isolation. I think we all suffered in all families, right, of isolation. It has increased that. Disruptions of care. The study we did across Europe with 7,000 answers from patients and families indicates that 9 out of 10 had some sort of disruptions of care, like cancellation of appointments, of no access to medicines, etc. But for 3 in 10, it had a severe impact, and with long-term impact they were considering. And for 1 in 10, they considered it life-threatening. You know that for 1/3, the centers were closed. Others were, another third were discouraged to go to the hospital. We had cancellations of lung transplant and other organ transplant. There were weekly infusion stopped for several weeks, and etc. So lots of consequences. But on the positive, I'd like to insist on the fact that telemedicine has grown considerably. So all the e-prescriptions, all the consultation online involving an expert at the hospital and the family doctor. And another positive is that the European Reference Network has been recognized immediately for their role in COVID, the role they could play in COVID. And the virtual clinical board enabling clinicians to exchange has been widely used from the beginning. So suddenly all the member states realized, wow, okay, European Reference Networks are not only for rare diseases, they can be useful in a case of crisis like this one. And now we're advocating to have a European Reference Network for rare infections, which is something we asked already in 2015, 2016, but we didn't succeed. So we hope to have it next time. And also, we would like the European Reference Networks to play a role on the long COVID, these patients which have long-term consequences of their infection with COVID, either neuromuscular consequences, lung consequences, or sensorial consequences. And here, the specialized centers of some of the RNs could come together to play a bigger role, because today these patients are rare, clearly, in the population, and they are lost in the maze to find a good support. Another thing I want to mention on COVID to conclude is to say that the vaccine, the mRNA vaccine developed by Pfizer, BioNTech, but also by Moderna, are based on research which was initially funded for some rare diseases, particularly on the amyloidosis transthyresis, if I say it well, but also in some rare cancers. So the research done in some rare population is useful at some point for the population. So somehow the investment made in the last 20 years in the field of rare disease, of research for rare disease in Spain and in Europe, has already had a return of investment 1,000 times higher with these vaccines, which came in pretty early in the pandemic. But also Europe has learned to work together, the member states, on negotiating the volume of the vaccine and the price of the vaccines for all Europe. What was impossible a year ago is now possible. Member states agree that they can work together to negotiate and to do joint procurement. This is what we want for medicines for rare diseases, maybe not for all medicines, but certainly for the ones which are the most complex, the gene and cell therapies or other very advanced therapies, and for the smallest populations. So with that, I stop here. I wish you an excellent meeting today, and I wish I could be with you in presence. Thank you very much.
Thank you. You're welcome. Thank you very much, Mr. Yann Le Camm from EURORDIS, Rare Disease Europe. So, good news, good news. Thanks for being. Bons propòsits, bones notícies també. Com a mínim estem en el panorama. Malalties minoritàries està en boga des de fa 2 anys, haurien d'estar-hi des de més, en boca de les Nacions Unides, però sí que aquests objectius de desenvolupament sostenible les hi tenen en compte, estan agendats. Aquesta agenda 2030 doncs, també té en compte paraules com les deixava paleses en el seu discurs, rendiment i innovació, sobretot també focalitzar en el futur, aquests nounats que actualment entre un 3 i un 5% doncs els nounats estan afectats per malalties minoritàries, aquest research and care que comentava el senyor Le Camm, i sobretot perquè tot va junt, it comes together. Gràcies doncs per aquesta ponència inaugural que ens obre les portes en novetats pel que fa a aquesta legislació també europea i aquesta agenda 2030.